quitting our jobs. 6,000 shekels wasn't much, but it was what we had, each one of us, so was giving away our salaries. And flew and went to this crummy hotel, and both of us slept in the same queen bed together. And we are moving the next morning. We are going to the Moscone Center, Convention Center in San Francisco, and we come to the first days of lectures and just to learn what other people are doing. And what we find is that there are two other companies who have sort of the same idea as we do. You may have heard of them. One is IBM, and the other one is Kaiser Permanente, which is one of the biggest medical health provider on the West Coast. So I cannot describe to you the sort of the depression, because we were sure we were going to conquer the world. I mean, like, we knew it. And it took us some, we planned it for, let's say, several months, and left our jobs and went to San Francisco with our savings, without having salaries. Both of us had kids back then. And we come, and took us, I would say, we landed at around 10 midnight, and then around 12 the next morning, 12 noon, we knew we were screwed. I mean, no chance on earth. IBM and Kaiser Permanente. And we went back and, to the hotel, and, we had to wait a few more days until our flight back home, and we truly didn't know what to do. So we went back home, and, going back, and I would admit that the head of the department at Tel Aviv Medical Center, she told me, Yair, whenever you want to come back, so whenever you want to go back, perfect. Thanks, okay. You can. You have an open door. But we are proud people, and we don't want to go back with our tail between our legs. So just to tell you, this is where we left. This is more or less the type of hotel we slept in San Francisco. That's how we came back. Really, really depressed. And we didn't want to go back to the hospital. So we figured, okay, we need to figure out what to do, because this big idea, or big data idea, is not a great one, obviously. Or even if it's great, we are not going to be the ones who are going to solve it. And as you know, or maybe you don't, so far no one has actually solved that problem of big data in medicine. I'm sure it will come, but and then what we started to do is do two things. First of all, we went a lot to daily shows. So we went with 11 o'clock. I don't know if you went, it's the last time you went to movies at 11 o'clock in the morning. It's an experience. You go with people who either don't have jobs or are on pension, so it's like a unique crowd. So we went there, and every day we went to a movie for about 4 months, I would say. I mean, obviously the level of, we weren't picky about the movies very soon, and obviously we didn't have lots of money, because no salary, nothing, so that was basically our lunch. We lived in my partner's apartment with his wife and kids, and about 4 months later she decided, Barak is the name of my partner back then, and she said, you need to go out. I mean, I'm not going to feed you and clean after you anymore, and no coffee and all these things. And we were sort of kicked out of the house. And while we were, between falafel and daily shows, we figured, we need to do something. And what came out of it is a company that I want to share with you here. And you know, one little learning maybe is that while we were there practicing doctors, and we thought, you know, we are doctors, there is information in the medical space, we can, so you know, it's our field. Well, big data is 100% not our field, and really what we went back to is something I would say more basic, but something that was where we maybe were not at that point in time the experts on, but definitely something we were able to comprehend. We understood the problem very well, because that was a problem that was something we dealt with every day in the clinic, which was the #1 cause for blindness, which is called age-related macular degeneration. It's not, the thing is not important, but just to say it's a huge problem in our world. And what people were using back then to diagnose it was a piece of paper that was invented in 1940. So we said, and people who typically have this disease or start developing this disease look at this piece of paper and are seeing it blurry or with black spots. So we said, you know, we can surely make something that's more accurate and sophisticated than a piece of paper that was invented in 1940. I mean, actually, I remember myself saying, I can do it with my hand tied behind my back. That was my expression. You know, I was obviously arrogant, stupid, and maybe it was among the 500 mistakes I've made since then, maybe number 167, but it's never simple. It just, and just to give you an idea, Natal Vision, which is the company that came out of it, is now 19 years into its existence. Over $8 million have been spent into the company. It's a company that is now operating primarily in the US. It has a large sales force, 75 or so employees, an R&D headquarters, R&D in Israel. But still, this was a company that is still backed by VCs, and $80 million 19 years later. So for sure it's not simple. And the amount of problems that came along our way are immense. And just to give you an idea, we solved the technological issue maybe 6 months into the project. 6 months after we started this project, we had the technology to detect this disease way earlier than anything else that has been developed before that or after that. But even that, just having that solution, we are still struggling, or the company still struggles to get through the regulatory, through the selling, through the reimbursement, through competition, through all the things that Ariel has talked and will talk to you about. So just to say, don't underestimate the issue. On the other hand, I can tell you for sure that if I knew all these problems ahead, I probably wouldn't have been going to start that company. So in this, I would say, stupidness or ignorance, there is something that gives you the courage, or the stupidity, however you want to look at it, to move ahead and do things that otherwise you wouldn't have done. So this gap is very, is a curse and a blessing in a way. And it's true for every entrepreneur. I mean, there is no way, even after Ariel will walk you through this entire program, that you will have a good understanding of all the problems that you're going to face. Just to give you a sense on what have I done during the last 19 years. So Natal Vision was the first company I've started, and I never started anything by myself, by the way, and you'll see the team members. I moved then to the Bay Area where I met Ariel, where we started several other companies, Nexus Vision, Vision 4, Vision 5, Vision 6, came back to Israel and started 2 more companies. Nexus Vision is being reinitiated these days. Vision 4 we sold to Genentech, Vision 5 we sold to Allergan, Vision 6 has a strategic relationship with the biggest company in the field. Presby is the same, and Azura is venture-backed that raised already $22 million and is in clinical trials in Australia right now. So that's my sort of where I've spent the last 19 years, and it's not one after the other. It's at least the way I like doing things is I do it together. So right now I'm involved in 4 companies. These 3 and Natal Vision that's still as I said, is commercializing in the US to some degree, and some of them I run the company, some of them I'm consultant, and everything in between. I'm sure Ariel talked with you about that, but the guy that went with me and left the hospital with me was Barak, who I convinced to come into ophthalmology, and then he decided to together with me to leave the space. But and that's Anat, who still heads the department. One of the she was nominated one of the top 100 doctors influential doctors around the world. So she's really something. But all these people you see here, Jean and Anne and Carrie and Omer and Angela and Gidi and Signa, are all people with whom I've started the company. And the reason I put their pictures on here is that I cannot stress strongly enough how critical are these team members, and of course this is just the tip of the iceberg. Behind that, behind every company, there, as I said, Natal is 75 employees, and other companies are 3 employees, and some are 15 employees, and so forth. So lots and lots of people and hard work is going, and the notion of an entrepreneur carrying this by themselves is really not a realistic thing, and I know, at least from what I spoke with Ariel, that and by asking the question, maybe 2 or 3 of you said we have maybe someone, or you said half a person that will join you. The sooner you get to join forces with someone else, your success is going to increase. Not only because this guy or person is going to give you the great idea, it's because this is really working in the trenches. And I can tell you that, you know, as I said, Barak he's the guy I slept with in this crummy hotel in San Francisco together in a queen bed. And since then we really went through mainly failures, lots of failures, and we'll talk about some of them. But really, that partner is, aside from the horsepower and brain and other expertise that they can bring on, is also the person who will help you when you're down. And this is because this is going to be this experience in San Francisco that I told you about was just one experience. We had failed clinical trials. We had the company, this one, where $30 million have been invested into this company. we started it. I was the chief technological officer for this company, and we were not able to deliver the technology. We just weren't able. I mean, we tried hard, $30 million, and we just couldn't deliver. And believe me, taking $30 million from investors and coming to them one day after 3 years and telling them ain't gonna work is a very bad feeling. And you know, now we are trying to reinitiate this company, and we have strategic interest in it, and we have discussions, but this company was started in 2008, and now we are 10 years later, and maybe we will be able to get it restarted and make something out of that technology. But lots of failures, and I'm just giving you, you know, a handful. I view this as a success. And the reason I view this as a success because it means we started. Like I said, the technology is going to fail many times. The problem is going to change. I can tell you that when we started the first company, you know, television, the one that's now in commercial phase in the US, this is what we developed. You know, we thought a big machine to diagnose patients at home. We had, the technology was sort of a visual field technology, doesn't matter really, but we wanted to give this to clinicians who would then diagnose their patients with, because there was no diagnosis for this disease, as I said. We were lucky enough that a strategic company, Zeiss, you may have heard of it, is a big player in our space, thought that were under their own stress because their main product was, you know, sales were declining, and they thought, you know, this could be the next big thing, and they signed a distribution agreement with us. It took them a year to understand that they're not going to sell even 100 boxes of this. They thought that they are going to sell 9,000 boxes of this every year. It took them a year, and they weren't able to sell even 100 boxes of this. And
Why?
because nobody needed it. No, doctors just didn't need it, because this disease is a disease that develops very rapidly. This Amsler grid that I showed you at the beginning is something that people, you know, it's this piece of paper, free. People take it home, they look, they stick it on their fridge, they look at it in the morning, you know, right eye, left eye, and so forth. If they see blurry, they go to the doctor. This is what you need. You need something that's at home. We developed a machine because, like I saw there, you know, what the customer wants. We were doctors. We weren't, you know, we are used to not to ask the patients what they really wanted. Reflecting back, we know what they need. You know, it's like this thing, and actually, it's true in many conversations. Israelis in particular, we don't let the other person even finish their sentence because we already know what they are about to say, and then we already have the response, and that's the sort of conversation. Yeah, only doctors. I'm willing to take the. So we didn't talk to customers. Really, we didn't talk to strategics. The strategic companies that signed this deal with us didn't talk to doctors or telemedicine. They were as stupid. I mean, this is Zeiss.
You didn't try it on the customer before?
Yes, you can try. It works. The
No, but
technology.
the input from the customer, no.
No need. No need. We knew. I knew what patients needed, and Zeiss thought they knew as well. They had a very, I would say, very nice. Jim Taylor was the CEO of Zeiss back then, and he made the decision. He said, you know, I remember him sitting on the graph. He says, guys, he asked me and Barak, how much do you think it's going to sell a year? I said, you know, we don't have a clue. I mean, we're just simple doctors. We just came from out of the hospital, and so he drew a graph and he says, you know, this is what I know from other, and of course he wanted to take it down so he can offer us a lesser price for, you know, our contract, and he said, you know, this is typically what we see with this and the, you know, but you are here or something like that, you know, and now we need to get discount, and you know, but at the end he said, you know, and after all this, you know, discounts, he got to 9,000 boxes a year. Says, Jim, you're the, well, who are we? That's fine, go ahead. Where should we sign? And we signed. Took them a year to figure out that it's not going to happen. Not only that, another technology that they internally developed, they almost gave it up, suddenly picked up, and today just taking it 10 years into, or more, 14 years into the future. It's the horse, you know, I would say what we call the bread and butter of every ophthalmic clinic across the world. It's the optical coherence tomography, OCT. This is what Zeiss developed for ophthalmology. They were almost about to give it up, and because they were about to give it up, they thought this is what they need. Cut a long story short, the one thing that we got out of it was in arbitration, because they didn't want to pay the contract and so forth. We got $10 million, and these $10 million saved the company. And what we developed is a home device, which is what really the customers, because I showed you the answer. So what we needed to give them is something very simple that they can do at home, that can be communicated to their family, to the doctor, to everyone, that they can do, and that's what is being sold today. So, but obviously, without, you know, failing here, without doing this, which is sort of my equivalent to our first device, we wouldn't be able to go to the next step and eventually develop the stairs that would sort of lead us to where we are now. I want to finish, I don't want to burden you too much, but really finish with three little examples of other companies that I've been fortunate to start with my partners. And this is a company where 4 years ago we started. You know, we had an idea for a contact lens for presbyopia. Presbyopia is a condition that affects people my age, where we need reading glasses. And in the contact lens world, if people who are contact lens users get to the age of 45, typically they throw out their contact lenses and are putting on their reading glasses. That's the typical solution, and obviously for all the big contact lens companies, they're losing their market basically, losing another 30, 40 years of usage from their customers. So if you can develop a contact lens that can give both distance and near at the same time, you have a win. So he said, you know, we know how to solve it. We went to Johnson & Johnson. Johnson & Johnson is the biggest company in the world to sell contact lenses. We told them about our idea. We talked with the head of R&D, by then we have very good connections with the big companies in our space. We were in this field for many years, so we can basically get to the you know, decision makers there. And we went to the head of R&D at Johnson & Johnson, and we showed them this idea, and he said, thumbs up. You guys go ahead, do a clinical trial, and if you are successful in this clinical trial, we want to take this project. We're going to pay you whatever, $100 million. Makes sense, we want it. And we went ahead for a year and a half to develop this contact lens. The Johnson & Johnson people came to the clinical site. they looked at the patients who were using it. The patients were 100% satisfaction, saw perfect to distance and near, and the Johnson & Johnson's the people said, we want to take it. I said, fine. He said, okay, we're going to take it in first, prepare us all the materials, the presentation. We're going to show it to a bigger committee of all the relevant people, sales and marketing and manufacturing and so forth. So, you know, just to give the final signatures on taking the technology in. And it took them 2 weeks, and they came and they said, we don't want it. Why don't they want it? Because they cannot manufacture it. Because in contact lens industry, you have mass manufacturing lines, and this is something that takes like 8 steps to develop instead of, you know, they're producing millions of contact lenses a day, and this is something that doesn't fit into their manufacturing line. And just to give you a sense, to build a manufacturing line for contact lenses is about $500 million effort. So no one is going to buy to do another manufacturing line for them and scrape their standard manufacturing process. Now, this is not something they couldn't have known on the first day we brought this project to them on a piece of a napkin. They knew it, but no one at Johnson & Johnson cared enough to show to the manufacturing people who said, guys, this is not feasible at all. So we wasted 18 months and money, of course, but for me it was really wasting 18 months on a bad idea that we could have known before. So understanding what is going to hit you along the road or what might not work later on is critical. We then switched ideas, we understood something, we went with a new idea, we went to Alcon. We went first to J&J, but they were already tired and didn't want to invest the effort and money, and we came to Alcon, which is the second biggest player in the field, and showed them our new idea about how to solve it. And now we did take into consideration manufacturing and so forth, and Alcon has decided to fully sponsor this project and commit to, you know, buying the company if and when we are successful enough or show a proof of concept to the technology.
Can I ask something?
Sure.
So along the process of this company, no one raised this problem? People put money on it without thinking about it?
I'll tell you, the people who put money in it were Johnson & Johnson themselves. So and then a few other investors that have invested in other companies that we have done have said, you know, if Johnson & Johnson is investing money into this, and not only that, they say that once the clinicals are okay, they're going to take the project in, who is going to argue with it? The thing is that Johnson & Johnson didn't put, you know, enough money for them to really care that, you know, that it's, you know, I think it was $1.5 million or something, I don't remember off the top of my head, but not something that bothers them if they can scrape it at the end of the year. And something that, like I said, they could have figured out way before. Actually, I like pointing the finger at them, but I should be pointing at it myself, because I should have not trusted 100% their judgment. I should have thought that I want to understand, yes, if they take it, can they manufacture it? Can they sell it? I need to know so I need to go to customers. You can't rely on anyone telling you anything, actually. I mean, this was sort of getting money from J&J, and the head of the VP R&D. VP R&D at Johnson & Johnson is sort of second tier person, like you have the CEO and the CFO and all this. So this is very high up, and this is the guy who, you know, says yes or no. And if he said yes, we were said, you know, we don't have to ask anyone else anything. A little bit similar to what we did with Zeiss, right? Also with Zeiss, Zeiss said, you know, this instrument will work great. I mean, we are committing to sell 9,000 boxes a year, but we never did good work at understanding all the, you know, either the customer or the manufacturing in this case. So now we did of course all that.